Hello everybody, this is Jamal Al-Maktri and I'm here today with Dr. Moustafa Elhousiny.
Thanks, Jamal.
Today we will be discussing about the coronavirus and the outbreak, the vaccine and the solutions. But before we start, can you please introduce yourself?
My name is Dr. Moustafa Elhousiny, PhD of molecular biology. My major specialty is cancer biology and molecular microbiology.
I'm sure you heard about the coronavirus and the outbreak. Can you please elaborate to us why is it so bad in some countries and less worse in the others?
The main reason for that is actually two factors. Is the countries that performed the testing and the screening, big sample size, and some countries actually done that really good, and specifically in Southeast Asia, some of the countries reached 300,000 scan per million person, which allows us to identify the diseased person and isolate them before they get to communicate and to socialize with other people and infecting them. So basically prevent the spreading cycle for the disease. The second one is the isolation and quarantine measures, which has been applied again in some countries early, and those countries succeeded and gained the control of the disease spread, while some countries implemented those measures late after they have the infection spread, and those countries I think now they have the worst case scenario.
How bad is it now? How bad is the situation at this very moment? And when will it get better?
Well, we can see that some reports started to show that the isolation and the quarantine measures that has been applied or that have been applied in many countries are actually effective in controlling the disease spread, and then we think that the situation will get better within the next few weeks, except of course of few countries. We can see that the cases are stabilized and at least not increasing in many countries around the globe. So hopefully, the disease will come to a halt soon.
Do you think that it will be halted before the vaccine or after the vaccine? And when do you predict the vaccine to be in the market?
Okay, let me answer the first question first. I think the halt will become before the vaccine, and the vaccine will to be ensure that everybody is immunized and control any subsequent outbreak for the virus. When the vaccine is coming, I just want to tell the people, because I've heard so many claims on the social media that some companies have the vaccine, some companies the vaccine, or just really close. Unfortunately, that's not true. The good news is the genome of the virus has been sequenced in many countries now and many research centers, and there's two genes in particular are identified as a potential target for vaccine development. However, vaccine development is really a long process. By that I mean, we have three types of vaccine. Either we have the antibody vaccine, where somebody who has an infection produces antibody, and then we isolate this antibody and start vaccinating the people with these antibodies. Second one is the inactivated vaccine, which is basically a microbe or virus that has been killed, injected, the body recognizes it as a virus, but it's not working, and then the body makes the antibody or the immunity for it. Unfortunately, with this type of vaccine, it's really weak. It does not give a long immunity, and it needs always boosters. The last one is the live vaccine. This is when we take the harmful agent of the virus. So the virus is still alive, still working, but it's not infected. And this is the strongest, of course, vaccine in the market. However, it has so many complications and side effects. It can cause cancer. It can actually retransform back into a live infective virus. So you have to be careful. Even with that, let's say that I'm a researcher and I found one of these approaches working, and I say, okay, I have this vaccine and I think it's a potential. Still, the problem here is there is a longer process to put this vaccine in effective and to put it to the public. We have to go through preclinical, try the vaccine into an animal model, and then do into a clinical trial 1 and 2 and 3, to make sure that vaccine first of all is effective and second is not toxic. That in normal times takes anywhere between 10 to 15 years.
Hypothetically, 10-15 years is a really long time. And in that period of time, even 1 year is a really long time. In like the virus can mutate in 1 year. Do you think if we created a vaccine within a 1 or 2 year time, the vaccine, like the virus could mutate to a different form?
Yes, definitely, yeah. That's an RNA
So
virus.
basically, like, the virus would be pointless to create a vaccine. We have to create another virus again.
No, I want to explain that to the people. So once you have the initial vaccine, once the virus has another mutation, all you have to do is just pinpoint this mutation, and 99% of this mutation will actually is harmful to the virus. Basically, it makes the virus not effective. It's just only this 1% that makes the virus more aggressive or more causing more diseases or more serious diseases. And then all you have to do is just highlight or pinpoint this mutation, and then modify the vaccine to work with this mutation. So it will be easier process, and you don't have to go back again through the process like the initial vaccine. You don't have to go to the cycle from the start again. So it should be shorter, way shorter than the initial vaccine. So the problem is to get the initial vaccine to the public, and then any subsequent modification will be, of course, easier.
All right. When a person contracts the virus today, and is there any possibility that he will contract the virus again in a couple of months or maybe in a few years, or we get immune to the virus completely?
Well, that normally was every microbe is that, but unfortunately for the coronavirus family, what we know about this virus, we are new. It's new for all of us, for all the human race. We haven't been exposed to that strain before, of course, because it's a mutated and new strain. But what we know from the coronavirus is some of the members, the infected person does not make a proper immunity. So on re-exposure to the virus, it can cause the same disease again. The new one, we don't know is this the same scenario or not. What we're proposing is it might be the same. So we're trying to tell the people, yeah, well, we have to do this quarantine and isolation for a bit of a longer period. We have to be a bit careful with this virus.
So there's no point of the vaccine. If I get introduced to the virus again in the future, I might contract it again. So there's no point for the
no,
vaccine.
I'm talking what I was talking about, the natural one. When I get the virus, when I'm exposed to the virus now, I got infected now, and my body take over the virus, I recover. Then after a few years, I get exposed again to the virus. Maybe or maybe not, my body will recognize this virus again. But with the vaccine, it will be a bit different story. With the artificial vaccine, will be a different story.
What about home remedies? How important are they? For example, garlic, honey, and ginger. Do they help in fighting and combating the virus, or are they just useless?
Yeah, this is one of the important points. Actually, we have to attract the people attention to it because of all these claims and on the social media that this garlic, this and that, can cure the virus. Of course, these reports are not peer reviewed, are not authenticated. No authority has said that, because the priority now is to control the disease, to treat the infected people. That is our main priority. For studies like this to evaluate the effect of these remedies on the virus or in the affected people, it takes a long time, and I don't think it's a priority now for any research center.
And one more last question. If I got the virus and I went to an ICU, will I have a permanent damage to my lungs? Yes. No, assuming that I got pneumonia. Or I will be recovered and I'll be doing my daily routine normally.
Sorry, I didn't get that question.
So for example, a normal person would go to, will contract the virus and will get the pneumonia. Does that person recover 100%, or he will have a scar in the lungs?
Again, that's another thing, is a few cases, individual cases or case reports that some patient has a permanent damage or a scarring or a fibrosis of the lung. But again, that's a very, very limited number. We cannot judge by them. And to evaluate that effect, we need a big study, cohort study, longitudinal study that takes many months and sometimes even years to follow the effect of the virus. What is after the virus, what is the consequence of the virus on those patients, respiratory system involved, and of course that each individual is different, the immunity system is different, the health status is different, so that will take a long time to have such data first of all produced and then analyzed, and then we can make a conclusion about that situation.
Thank you very much, Dr. Moustafa Elhousiny. Do you prefer a handshake or a fist bump?
None of them.